Ms Cummings. It's a pleasure to serve with you in the chair, and can I also congratulate my honourable friend, the member for Bromley and Chislehurst, in securing this debate, and thank the Backbench Business Committee for granting it. And indeed join colleagues in thanking a coalition of charities and organisations that have come forward to support with research and briefing assistance in advance of today's debate, particularly the Moving Forward Stronger policy paper. Prior to being elected in 2019, I also had a background working in the National Health Service, and never in my wildest nightmares could I have imagined so early on in the job, after leaving the NHS, we would be dealing with a global health pandemic the scale of COVID-19, and one that has permanently changed, I believe, the way we look and the way we plan health and care services in the UK. Just in the London Borough of Sutton, where my constituency of Carshalton and Wallington is situated, 600 lives were tragically cut short due to COVID-19. And if it wasn't for the dedication and the bravery and the care of our local health and social care services, I'm sure that that number would have been much higher. And I know that members across this House have only the deepest gratitude and thanks for the unsung heroes that were not just our doctors and nurses, but also associated health professionals, pharmacists, volunteers, and those who stepped up to do their part, which is partially why I launched the Carshalton and Wallington Unsung Heroes scheme, to recognise that dedication. And out of the hundreds of nominations I received, unsurprisingly, our local health and care volunteers and staff featured heavily among them. I can't possibly name them all, but I would just like to thank the St Helier Hospital eye treatment team, Rena, Sanja and Ravi, other local pharmacists as well, the head of occupational health at Epsom and St Helier, and of course the staff at vaccination centres across Carshalton and Wallington. At the time of the outbreak of the pandemic, there was very little public discourse, understandably, as we were grappling with something quite unprecedented, about the long-term indirect impacts of the pandemic on our health and social care system. But I know that I will not be alone in receiving thousands and thousands of cases from constituents during the opening weeks of the pandemic and during its peak, where there were way too many incidences of people with long-term and pre-existing conditions who were experiencing disruption to their care, and many of whom experienced much faster deterioration than would be usual or expected through no fault, I will hasten to add, of health and social care staff, but simply because of the situation we were faced with. And just some of the constituency cases I heard of were people with long-term cardiovascular problems, unable to get treatment, spinal cord patients who weren't able to be housed appropriately, and people with dementia and Alzheimer's who were cut off from social interactions that were so critical to keeping their cognitive and communication skills alive. And as an officer of the APPG on dementia, and as someone who has had personal impact of dementia in the family, I'd like to focus on this area in particular. In the London Borough of Sutton, there are over 2,400 people living with dementia, and based on recent trends, it's estimated that well over 3,000 residents over the age of 65 will be living with dementia by 2030. Now, that's an increase of approximately 25% in a very short space of time, and this makes up the almost 1 million cases of dementia nationwide. And people with dementia were very badly hit by the pandemic, as indeed many people with long-term conditions were. But dementia was the most common pre-existing condition for people who died from COVID-19, with people with dementia accounting for more than a quarter of all COVID-19 deaths in England and Wales during the first wave of the pandemic. However, the effect of the pandemic on people living with dementia goes far beyond just those statistics. They have also tragically seen accelerated progression of the number of conditions, and this has been for a number of reasons. First of all, we know that social contact is very important for people living with dementia, but this, of course, was restricted, again, for a very understandable reason, but this does exacerbate the issues for people living with dementia. For people living in care homes, for example, where more than 70% of residents have a form of dementia, these restrictions were particularly serious, with the Office of National Statistics estimating that 97% of care homes were closed to visitors at one point. Now, people with many long-term conditions, including dementia, rely on rehabilitation services to maintain their skills and abilities. And when provided with the right support, rehabilitation services can help people living with dementia maintain their cognitive, social and emotional skills, as well as meeting their physical needs and any other conditions related to it. Now, as mentioned by my honourable friend, the member for Bromley-Chislehurst and the member for York Central, these services were not able to meet everyone's needs during the height of the pandemic, and this was particularly true for people living with dementia, whose conditions often make it difficult for them to engage digitally, even if the service itself could be provided that way. And that means many people living with dementia have not been able to preserve their skills in the way that they otherwise could have. And this is exactly what happened to one of my constituents, whose mother, living with dementia, saw a dramatic deterioration during the first wave of the pandemic, suffering severe memory loss by the time she was able to meet with her family again. And for those living with dementia, interaction with family isn't just a nicety. It actually forms an integral, formal part of their care and treatment plan, as there is a causal link between the lack of social interaction and the worsening of the condition. But now, as we emerge from restrictions and we come out the other end of this pandemic, the long-term impacts will continue on the NHS, the care sector, and to people living with dementia. And I do welcome the determination shown by the Department of Health and Social Care in dealing with the elective backlog. It is a mammoth task. And I do also want to congratulate my own local NHS trust, the Epsom and St Helier NHS Trust, for the work that they've done. I've welcomed before the announcement of £500 million to both upgrade Epsom and St Helier hospitals and build another hospital in the London Borough of Sutton. But it's particularly their ingenuity I want to applaud them for, because as soon as they realised the scale of the pandemic that they were dealing with, they have been they've had the foresight to amend their plans for the development of the new hospital to ensure it can future-proof itself against future pandemics. But I now believe we need to see that determination from the department to deal with the backlog of deterioration that we have seen amongst those with long-term conditions. So I do join colleagues and indeed that coalition of charities and organisations for that national rehabilitation strategy for everyone who has seen their long-term conditions progress throughout the pandemic. And if planned properly, this rehabilitation strategy is also an opportunity to reduce pressure on other services, both within our healthcare and indeed our social care system. And I'm sure many colleagues here today have heard plenty of examples of people in their own constituencies who have ended up in hospital or needing round-the-clock care for entirely avoidable reasons, such as a fall, for example. But by helping people to maintain the skills that they have, they will be less likely to require support from acute care. For example, the Alzheimer Society estimate that up to 65% of emergency admissions for people living with dementia could be avoided. Both rehabilitative and memory services are under significant pressure, and right now the waiting lists are still getting longer. And this means that we do need those strategies to deal with those backlogs. And with the right planning, we can not only overcome these issues, but also deliver better, more personalised support, because, of course, people living with dementia deserve nothing less.